It's special tubes whereby we extract blood, your own blood, spin it in special machines called centrifuges.
Okay, I want to wrap my head around this.
Yeah.
Say that again, please.
You don't need the luxury brand. The earlier you start doing botulinum toxin, you can actually turn back the clock. So you can still smile, you can still frown, you can still look surprised, but without the lines.
So by inflicting calculated damage to the skin, it triggers its natural ability to fix itself.
Their acne is impacting their life, their job, their school, their social life, their marriages, their relationships.
I use a tanning. I mean, I'm tanned enough. I don't use upon my legs tanning cream. Obviously, it's not good, right?
Not at all.
Hi, I'm Hela, your host today. We'd love your support. A quick subscribe to this channel would mean a lot to us and help us grow. We may be small now, but with your support, we can achieve something amazing together. Thank you. Welcome to the Visionary podcast, where we discuss science, medicine, physical health, and mental well-being. Dr. Hiba Injibar, you've been a dermatologist for the last 25 years. You practiced medicine in Saudi Arabia and Lebanon in the past, then you moved to the UK. Culturally, people look after their skin more in Lebanon and Saudi Arabia than here in the UK. Why was the move necessary?
Quite frankly, we just wanted to move away from the Middle East, which, we love our country, we love Lebanon, we loved living in Saudi Arabia and working as expats. But we just wanted a new life for the kids, and that's why we moved. So the move was not based on career choices or a job offer. It was a family decision.
Yeah, I totally relate to that. I moved to the UK 15, 16 years ago to marry my child, his father, now ex, but yeah, I totally get that. Was there a defining moment in your life when you decided, I want to make people look pretty? Then you went ahead and joined medical school.
And medical school is a 4-year graduate degree program. So I did that whole 4 years. And by the end of those 4 years, you have to choose your specialty, right? It was time to choose my specialty. And I thought, I love a lot of things, but I love children. Let me go into pediatrics. So yes. I did my internship in pediatrics, and I didn't like it at all.
Why was that?
Well, because what I love about medicine is communicating with the patient, talking to the patient, making the patient better, making the patient happier. And this is what drew me eventually into dermatology. In pediatrics, you can't really communicate with the patient. The patient cannot tell you what's wrong. They're crying all the time. You feel sorry for them. Parents are very anxious, and you have to deal with the parents who are not the patients and sometimes ignore the patient because the parents are very nervous. And then we had to go on the ward. I spent a few months on the cancer ward with children, and that made me so depressed. And this is when I realized dermatology is wow. This is what I want. And it wasn't initially about cosmetic dermatology. Of course, we had some training with aesthetic medicine, but the dermatology core training is skin diseases, and that is what caught me. It's just the fact that I'm a very visual person, tactile person. I like to see things. I have a visual memory. So it was so interesting that compared to other specialties where you sometimes have to rely on blood tests and imaging to actually diagnose the disease, in dermatology you actually see it and it's looking at you. And it's so visual. And I loved the surgical aspect of it because I found it so interesting and so varied. You're not stuck with, let's say in pediatrics, it was colds and, runny noses and vaccinations. Here, every single patient is different, even if it's the same disease, because you actually see the disease. Every single rash is different. Every acne patient is different. Hair loss, and it's the hair, the nails, the skin, and it's the largest organ in our body. So that is what attracted me. And up until now, even though I've been practicing for 25 years now exactly, because I qualified in 2000. I love cosmetic dermatology and I love aesthetic procedures and I love lasers, but I'm still cling to medical dermatology. So I still want to treat rashes and, fungal infections and nails and hair. So yeah, that's what drew me. And it's also like the lifestyle. Dermatology is it's extremely competitive to get into a dermatology program, mostly because of the lifestyle. You don't get emergencies. You don't need to do night shifts in the hospital mostly. You can be fully private. So lifestyle is very appealing.
Yeah, of course it is. And I know that the exact complexity that fascinated you and you found amazing is why dermatology is such a challenging field.
Yes.
What you found amazing is what makes a good dermatologist a very rare thing. Let's start with one of the most talked about challenges in skin condition, those stubborn wrinkles. Why do some people get wrinkles earlier than others?
So genetics does play a factor, of course. Ethnicity and genetics do play a role, a small part, let's say. Lifestyle is the major cause of early wrinkles. And of course, when we're talking about lifestyle, 90% of wrinkles comes from sun exposure. So early exposure as a young child to an adolescent, to a young adult, to a lot of sun with no protection will make you age earlier. So there are studies, and you can even find them online. These images are common, and I think I talk about them. I show the image in some of my talks and videos of identical twins who were they're identical twins and they were raised differently, or they grew up differently, or their lifestyle is different. One is exposed to the sun and one is more protected. And you can see a dramatic difference when they start aging in wrinkling, leathery skin, sunspots, fine lines, and this is all part of aging. Then other lifestyle things, smoking, definitely can age you more because of its oxidative stress. And also, like some people, some women mostly, they do take care of their skin early on by using sunscreen, good active ingredients. They consult dermatologists early on. They might start doing procedures as preventative measures early on, so they kind of delay their aging, and you can do that, absolutely.
Hearing you talk about sun exposure in childhood and going on holidays and all the rest of that, I think that's one of the reasons that I still have half decent skin at 46. I never go on holidays. No, I say never. I went to 2 holidays in my entire life. And this might really, I'm an indoors person, I'm a domestic person wholeheartedly, so it might be one of the reasons. People spend hundreds, if not thousands of pounds on skin creams. And are we just paying for fancy packaging?
You might be, yes. There are some luxury brands. A lot of them, actually, the way they sell makeup, they do package some creams and sell them for hundreds of pounds, but they might not be effective. They might be very expensive moisturizers, because if you think about it, when you need to buy a cream and use it, and if it needs to have active ingredients, even if it's not prescription, of course, as dermatologists, we prescribe some creams which are anti-aging, but even the ones that are not prescription, it makes sense that such creams, if they are going to have at least a decent concentration of active ingredients, you buy it from a pharmacy. You don't need the luxury brand. I think that just adds to the price, but not necessarily to the effectiveness of the cream.
Yeah. You talk about active ingredients. Most of us, me included, I don't know what active ingredients to look for. Off the top of my head, I want to make my skin moisturized and hopefully delay the appearance of, like, what we say, anti-aging. So which ingredients I should be seeking to moisturize my face to begin with?
There are active ingredients that work on boosting your collagen, hydrating your skin from within, antioxidant stress, as in normalizing your cells, preventing pigmentation or erasing pigmentation, improving fine lines, preventing fine lines. So as a dermatologist, that's what I want my patients to be using. So the main ingredients would be vitamin C.
Vitamin C.
In concentrations of 10% or more. You wouldn't find 10% in any creams. It's more medical grade cosmetics that's in pharmacies or dermatologist offices. Glycolic acid is a very nice one.
Glycolic acid.
Yes.
Okay.
Something I tell all my patients to use, and I've been using this for 30 years. It belongs to the range of creams we call alpha hydroxy acids. They exfoliate the dead layer of the skin, because when you exfoliate, when the cream exfoliates your dead skin cells, you get a glow because you lose that dull texture and look.
All right.
It boosts the collagen and prevents pigmentation. Of course, the retinol or tretinoin, which are vitamin A.
Vitamin A.
derivatives.
Retinol or?
Tretinoin, which is a prescription grade.
Okay.
And even retinol is prescription grade, except for like very low concentrations, like 0.2, 0.1, which you can buy over the counter.
Will I benefit from the low concentration?
You will. At least it's better than nothing.
Okay.
And retinol will boost your collagen, push your fibroblasts to produce newer collagen. It exfoliates the dead cells as well. It hydrates the skin from within, including glycolic acid. So that is how you would improve your skin texture, keep that youthful, glowing look. And of course, you would need moisturizer. But I tell my patients, if you feel like some people have inherently oily skin, they don't really need to moisturize. If you feel your skin is dry, and of course, when you use these acids, your skin will dry a bit, you will need some moisturization. But moisturizers are not the mainstay of good active ingredients.
Okay.
You can use a moisturizer in the morning with sunscreen. There are some medical grade ones that I like and I recommend to my patients. We can mention later. And of course, the best thing is sunscreen daily.
Yeah, amazing.
And I think you will mention this
now,
later.
You mentioned 3 ingredients. Can I use them all at the same time, or do I have to use them one at a time, like one in the morning, one in the evening? How does this strategic setup go?
So I always tell them to use vitamin C in the morning because it's antioxidant. So the oxidation you get from the sun exposure, it prevents it from
That's before
damaging.
the sunscreen or after the sunscreen?
Before
the sunscreen. Okay.
And then you can apply your glycolic acid. You can use it in the morning. And then I would tell them put sunscreen and moisturizer. And then all the retinol and the tretinoin and the vitamin A derivatives are night creams.
Okay, it's so good
So you
to
can
know.
use them at night. If you need a moisturizer, you put it over them. And you're all set. It's just 5 minutes, 2 minutes.
Now, anti-wrinkle injections are super popular these days. What do I need to know before I get them?
So anti-wrinkle injections are the mainstay of cosmetic, like they are the gold standard of cosmetic dermatology procedures. And they are divided into basically 2 things. So we have the botulinum toxin, also known as Botox, which are anti-wrinkle injections that target the expression lines. So they are injections that relax the muscles that are pulling on the skin. So when we're frowning, we're expressing, we're smiling, we're tightening our neck, the muscles are pulling on the skin and causing it to wrinkle and to age. So botulinum toxin is one of the anti-wrinkle injections that relaxes the muscles, thereby preventing this movement and relaxing the skin at the same time.
So if I have these
Like,
lovely
yes.
lines here or smile lines.
Smile lines would not be anti-Botox injections. Smile lines would be the next thing I'll talk about. It's more for, this frown, the 11, they call it the 11 or they call it the frown,
Yes.
the forehead lines, the smile lines when you smile, which we call crow's feet.
I have that.
Yeah, crow's feet. And Botox is also done. Advanced Botox can be done to repair the smoker's lines, the neck muscles, the tight neck muscles, which pull on the skin down.
Yes.
So these are the Botox, the anti-wrinkle injections.
You said smoker's line. So if I'm a smoker, if I was a smoker, would I have lines here?
And you can have them even if you're not a smoker, but we call them smoker's lines. It's, when you purse your lips, some people have lines and they don't like them. So the Botox, the botulinum toxin can relax the muscle you use and thereby relax these lines. It can be used for the frown lines because also there's a muscle that pulls on the angle of the mouth. So we can relax that muscle. The other main anti-wrinkle injections, if you want to call them, are dermal fillers. And dermal fillers are syringes that come pre-filled with manufactured hyaluronic acid, mostly hyaluronic acid. There are other ingredients, but the most commonly used and the safest is hyaluronic acid. So we do have hyaluronic acid naturally in our skin that normally in our youth keeps it like fresh and young looking. And as we age, we kind of lose collagen, elastin, and we lose that turgor that our skin has when we're young. So these pre-filled syringes of dermal fillers come with different concentrations of hyaluronic acid that can be injected in the skin and that we inject in different areas to repair mostly volume loss. So as we age, we lose volume in our skin, and that's how we get lines under the eyes, in the cheeks, here, in the lips even, in the temples. So things kind of shrink in, and with hyaluronic acid dermal fillers we can repair this volume loss.
Makes the skin plump again, right?
Yes.
Now the big question, will these treatments make my facial expressions stiff and rigid? Will I be able to raise my eyebrows or smile naturally? We've all seen those celebrities with frozen faces.
Yeah.
Was that like a bad job or old school techniques?
It's a bad job and maybe old school, but it's technique dependent. So your question is, what should I know before doing it? You need to know, most importantly, who's injecting. Know their approach. Make sure they give you a natural look. Make sure they are extremely well experienced in doing this so they don't mess it up, because Botox might seem easy, and that is why now it's so commonly done by anyone, which is sad. And that is why you see people with eyebrows that are asymmetrical or funny faces, or they look unnatural. It's because it may look simple, that there are a few injections and that's it, anyone can do it, but no, it is not. You have to really know the anatomy, really know what a natural look is, really, like I do it multiple times a day for 25 years, but I still, every time I inject someone, I make them move, I make them smile and frown, I look at their face, so I maintain their natural look. So you can still smile, you can still frown, you can still look surprised, but without the lines.
I grew up in the 80s hearing about Botox, so it's as old as time. Can these injections also prevent new wrinkles from forming?
Absolutely, yes. They can prevent new wrinkles. So the earlier you start doing botulinum toxin, you can actually turn back the clock. You can prevent aging and prevent lines from forming, because if the muscle is not pulling on the skin all the time, and if you kind of relax it early on and keep doing that, you prevent the lines from forming. So I've never had any lines up here, on my forehead and between my eyes, and I'm in my 50s. So you can prevent the lines. I wouldn't tell patients to start very early. I think, early 30s, some people start I started in my late 20s because I was a dermatology resident and we were training on each other. But you can start
training on each other. I love it.
But and also it depends on whether you're someone who uses a lot of facial expressions or not. But there are some people who use a lot of their muscles when they're talking, and they get early forehead lines and frown lines. So yes, absolutely, it can prevent it.
Yeah. How often do I need to do that, whether I start early or late, to prevent new wrinkles from forming? Is it a monthly thing?
No. So the effect lasts 4 to 6 months. So ideally, if you want to maintain your result, like twice a year, maximum 3 times a year, the more you do it, the longer it lasts. With dermal fillers, the newer advanced dermal fillers would last up to 18 months once injected, and then they dissolve completely. But their presence in the skin, the hyaluronic acid, also stimulates the skin to keep itself hydrated, and it pushes the skin to kind of repair itself. So again, when you start early on with these dermal fillers, even though they dissolve completely, you do get a prolonged result and a kind of a preventative approach to the wrinkles or the lines to a certain degree.
Acne. Let's talk about acne. You also give lectures and seminars about acne. I can imagine that you get lots of questions about this condition, considering how many people have it. What do GPs get wrong when they treat acne?
Acne is a passion of mine. I'm very passionate about treating acne and helping people and preventing acne because I see a lot of people with acne, a lot of children and teenagers, and also many adults. And I know it's severe impact on their mental health, on their self-esteem, on everything, really, even their education. What they do wrong is they dismiss it as just spots, whether it's, sometimes parents, many times GPs, they don't really listen to the patient. They just look at them very quickly, prescribe antibiotics and creams, send them off, tell them come back 6 months, 1 year later. They come back and say, I'm suffering. And then they start seeing signs of depression. So instead of treating the root cause and referring them quickly, they might refer them to talking therapy or might prescribe antidepressants. So it's a vicious cycle and a loop. I think what they mostly do wrong is they don't take it very seriously and they don't refer easily. I get patients coming to me privately, having been in the, with private healthcare and not getting anywhere, and their acne is impacting their life, their job, their school, their social life, their marriages, their relationships. They don't get anywhere. They keep asking the GP to refer them to a dermatologist, to the hospital. And then eventually they give up. But sometimes it's too late. Many times it's too late.
Yeah, because the demand is massive.
I know.
I've always had psoriasis, I'm assuming my entire life. But recently I was diagnosed with flexural psoriasis. I say recently, but in the summer. And my GP, which is a brilliant GP, he did refer me once we figured out what was going on. And I was still struggling. But till now, I haven't seen a dermatologist. That's like 9 months. I walk into a bakery on the high street and almost all teenagers have acne.
Yes.
Almost all of them.
Yes.
I mean, hiding under layers and layers of makeup. What is the root cause of teenage acne?
Acne is a very common disease. 85% of teenagers and adolescents have some degree of acne. It's their hormones and the surge in hormones, namely testosterone, that affects the oil glands in our skin. In our skin, we have oil glands called sebaceous glands, and these glands are attached to the hair follicle, and they secrete a substance called sebum, which is the oil, the thing that hydrates our skin. So these glands, these tiny little microscopic glands all over our face, chest, back, and shoulders, this is where they are mostly predominant. They get stimulated by testosterone, which is the hormone. And that makes the oil glands secrete more oil, become hyperactive. And also in the cause of acne, there's clogging of the pore. So there's clogging and there's excess oil secretion. So that oil accumulates, or that sebum accumulates under the skin, causing these little bumps that we call whiteheads. These are the early, baby lesions of acne. And then these get inflamed with bacteria and inflammation, and that's why you get the big red pimples, the pus, the cysts. But it all starts with the hormones causing excess oil secretion.
And this clogging is probably caused by makeup or wrong
It can
skincare?
be, no, it can be exacerbated by makeup, but it is caused by this whole disease that happens in the pilosebaceous unit, which is the sebaceous gland and the hair follicle.
So what do we do about testosterone? Does that mean that we have to fix something internally before we deal with acne?
No. This is like normal levels of testosterone. We have to treat the acne, which is the cause. The hormone levels are normal. Most of these teenagers don't have hormonal problems. It's their normal levels of hormones. It's just a disease, and it's a common disease, and it's prevalent in this age group. But that does not mean that their hormones are wrong, unless they have, and this is rare, it's the minority of women might have PCOS, polycystic ovary syndrome, and they might have excess hormone secretion, then we have to fix it. But they have other signs of PCOS, so they have facial hair, they have hair loss, and then they have the acne. But if they're only presenting with acne, and then they have also abnormal periods. But if it's only acne, we don't rush and test for hormones or do blood analysis or anything. No, their hormones are within normal range, but this is a disease that's more prevalent in teenagers, and we have to just treat the disease.
Yeah, I had PCOS when I was a teenager. I didn't have acne or pimples, but I had the excessive hair, facial
Yes.
hair, and my period was all over the place. Now, this begs the question, how do you treat acne at your clinic?
Sometimes they come in with a bag, they show me their skincare. I ask them, what kind of skincare do you use? Show me your makeup, your moisturizer, your face wash, tell me about them. And then I look at their skin. I stage the acne. Is it mild, moderate, severe, cystic, or scarring acne? Scarring acne would be top of the ladder. It's something I take very seriously and I treat very aggressively to prevent more scars. So I would look at their skin and I would assess what stage of acne they are at. So if it's mild acne, as in a little oily skin, some blackheads, some whiteheads, I would treat them with topical medications, like topical prescription medications. Prescribe some creams in addition to skincare, and I would advise them exactly how to use it, what to expect, how to cleanse their skin, how to moisturize, and maintenance treatment. If it's moderate acne, whereby there is some inflammatory component, so there are some spots, red spots, pus, purulent spots, spots with a little pus, then I might combine medication. So I'll give them some oral antibiotics with the topical medications. So not just, so combination treatment works best in acne. And then when we reach the stage of severe acne, scarring acne, then I would not just give creams. They don't really work. And that's when they come to me having tried so many topical prescription medications, benzoyl peroxide, azelaic acid, topical antibiotics, oral antibiotics, and nothing's working. Then I resort to strong medications to stop it, and especially if it's scarring, to completely abolish the acne and prevent further scars. And then I might prescribe a medication called Isotretinoin or Roaccutane.
Okay. How does that work?
So Isotretinoin is a medication that is derived from vitamin A. It's a medication that is only used to treat acne, mostly used to treat acne. It works on the pilosebaceous unit, that is the area in the skin where the disease starts, like I explained. So it shrinks the oil glands, it normalizes that pore opening to prevent it from getting clogged. It works on inflammation, so it targets all the aspects of acne. It's a very, very effective medication for acne, whether it's mild, moderate, severe, scarring, cystic. It works in 100% of the patients. And it takes a few months and then the acne is gone. It's only prescribed by dermatologists, so primary care physicians cannot prescribe it. Other specialists, I think, cannot prescribe it as well. So it's only us who can prescribe it, because we know how to monitor patients and how to avoid side effects. The main problem with this medication is that it's severely teratogenic. Meaning,
what does it mean, please?
It means that women absolutely cannot get pregnant while they are on it and for 1 month after they stop it, because it causes severe fetal side effects like birth defects. So it can affect the limbs of the fetus, especially when the fetus is being formed. So it's very strictly monitored, and we only prescribe it for sexually active women. If they are on birth control, they have to sign consents, they have to do pregnancy tests before, during. For every prescription, we have to I have to stamp the prescription saying I've done a pregnancy test, it's negative, the patient is on such and such birth control, otherwise the pharmacist will not prescribe it. So that is the main issue with it.
Okay. And how long would the side effect last? You mentioned a month.
A month after you stop it, you can get pregnant.
Okay. I can imagine that it's devastating for a teenager to have indentations and visible marks. It can have a real emotional and psychological impact. Now, I'm wondering, does adult acne stem from different reasons than teenage acne?
Adult acne can be a continuation of teenage acne. So teenage acne does not have to stop when you reach the age of 18. And that is why anytime you get acne, whether you're 9, 10, 15, you need to treat it. You cannot assume that, by the time I'm not a teenager, it's gone. maybe, but it can progress. So I see patients in their 20s, 30s, sometimes 40s with acne that has been on and off since they were teenagers. But if it just starts, if you've never had acne as a teenager, had no spots, and then suddenly you're, let's say, a 32-year-old woman and you start getting acne, then we have to look at other causes. Is it the makeup that you're using or your face creams that are too greasy and clogging your pores? Do you have some hormonal imbalances? Have you been on the contraceptive pill for a few years and suddenly you stopped it? Then you get a surge of, hormonal imbalances and you get acne. Some medications, are you on any medications that can cause acne? So those would be things that might cause acne in adulthood. And many times we can't find a reason. They just get acne and we have to treat it without digging a lot into the cause. If the cause is not obvious, relating to what I have mentioned, it could be a matter of just, a hormonal imbalance and we have to treat it.
I guess everything we eat, everything we do, apply on our skin does show up on our face. The skin is not a silent organ. I wake up with a pimple and I wonder, is it the last thing I ate last night? Is it my hormones? Is something environmental? It's really, really hard to tell. Tell me how my diet influences my skin.
To be honest, not to the extent that people think. So there are lots of studies that have been done linking diet to acne or diet to other diseases. With acne specifically, the link is not very strong. Yes, it has been found that a high glycemic diet, so a diet with a lot of sugar, lots of chocolate, can worsen the acne, but it's not a cause of the acne, meaning that some people, and that's what I ask my patients, do you notice that if you eat a lot of chocolates, your acne gets worse? Sometimes they say yes, sometimes they say not really. So I would say if you notice it affects your acne or it makes it worse, by all means, and it's actually healthier for your whole body that you take less sugar. But it's not like a direct link. Some studies have found it, some studies have found a weak link. And if you stop sugar completely, yes, your skin might improve, but you might still get acne. You might still suffer from acne, and you might need to treat it. So it's not a matter of like food allergy, like I have an allergy to tomatoes, let's say, and if I stop tomatoes completely, I'm not going to get that itchy rash or urticaria. There, the link is very close and direct. With acne, it's sometimes of a hit and miss. The other link was found. Lots of people come to me and they say, I've cut dairy completely out of my diet and I still get acne. I'm like, yeah, because it's not directly linked. The newer studies have found maybe a link with only skimmed milk and not full fat milk or cheese. So yeah, it's a hit and miss.
Milk is a thing that will give you acne.
Not necessarily. Okay. There was a link. It might make it worse only, or it might flare it up.
Okay. Is there a reason why some people might scar more than others?
So it might relate to like ethnicity and skin color. Yes, we do notice, and I do notice that Asian skin can scar more. Black skin can, produce some types of scars more than white skin, like keloid scars. It has to do also with the depth of the injury. Like how big is this wound or the surgery or the burn? How bad is your acne? Is it cystic acne to leave worse scars? And how the wound is stitched. For example, you have a big cut, you rush to the A&E, they just suture it very quickly because it's the A&E, or you have it done by a plastic surgeon or a dermatologist, which is very careful about how your skin will heal. Mm-hmm. Then you get a better scar. So there are multiple factors on why you would scar.
Yeah. Is there like the golden window where early intervention will make the biggest difference in how a scar heals?
Yes. So the earlier it is treated, the better the outcome. So there are recent studies that point to the fact that as soon as stitches are removed, we can go ahead and do some mild intervention to help push the wound in the right direction to heal. Some things like non-ablative fractional laser at a very low dose that helps promote healing and improves wound healing. And then if the scar forms and it is unsightly and the person wants to treat it, yes, the earlier the better. When the scar is still fresh, it's been like a few months, sometimes even like a few years, but not like 10, 20 years. It responds better to treatment before it actually becomes a very formed old scar. But having said that, I treat scars of all ages. So I treat people with acne scars who haven't had a single spot of acne for 20, 30 years, but now they want to treat their acne. Or a trauma scar or a wound, a scar that is very old, it can still respond.
What's a trauma scar? Like a hit in my skin?
Yeah, like you fell on the, on the street, you hit your chin, you cut it, blast injuries, that would be things like a knife injury. So these are trauma scars, basically.
Yeah, I see those over-the-counter creams for scars. Any good?
Not really. No, the only thing that might give a little benefit would be creams containing a good concentration of silicone, but they're barely scratching the surface, so they wouldn't really do much for scars.
Okay. Let's have a look at diet. You do stress the importance of diet for skin health. Which skin conditions that might be affected by poor diet?
So psoriasis is one.
Really?
Yes.
I thought it was an autoimmune disease.
It is, but it's also linked to metabolic syndrome. So high cholesterol in the blood and high triglycerides might impact psoriasis. They're all linked together. Acne, we talked about the fact that it might not be, and hair loss is not like about what you eat, but if you have some deficiencies in some things like iron, vitamin D, if you have a very restrictive diet, let's say whereby you're not eating enough iron, you might get hair loss. If you're on a very strict diet whereby you lose weight suddenly and a lot, you can lose your hair. So hair loss is one of them. But otherwise, it's just, seborrheic dermatitis, seborrheic eczema, a type of eczema. Recently, I was reading an article that they found that might be linked to a poor diet. But
should I supplement my diet with vitamins and minerals?
I say only in this country, because we're not exposed to the sun on regular basis, the only thing you need to supplement your diet with is vitamin D. Anything else, if you have a varied diet, a well-balanced diet, and you're eating meat, fish, vegetables, fruit, dairy, no, you don't really need to. It's only when you have a deficiency. So,
skin care products, all those skin care products that we buy from pharmacies, they are not medical grade, are they?
Skincare products, it's a huge market, a multi-billion dollar and pound market. It's, of course, no human, maybe AI now can keep up with how many brands, but no human brain can keep up with all the different skincare products. The good skincare products, let's say rule of thumb, good skincare products are bought from a pharmacy, not from a department store, and they are either recommended by your dermatologist or by your skincare specialist or maybe the pharmacist. And a lot of them are over the counter, so they're not prescription. So you don't actually need a doctor's prescription and stamp to buy them, except for some, yes, you do. Like I mentioned, the retinol, the tretinoin, which are also unsafe when you're pregnant. So you need prescriptions for those. The others, you can buy them over the counter. You just need to know what to buy, what percentage, which brands are good, which are pure. But the rule of thumb is they are in a pharmacy. They are not sold by someone who also sells you your lipstick or recommends your, T-shirt or blush. So they're medical grade.
Is there a difference between the medical grade and the cosmetic? So we're talking in a pharmacy, it's by default medical, and in other like department stores, that's the cosmetic stuff, right?
Yeah, I mean, if you want to differentiate between them, yeah, normally things in pharmacies are medical grade. They might not have the exact ingredient or the concentration that your skin needs. And that is why, dermatologists would say, no, go for 20%, 30%, 15%, take this prescription retinol. But creams that are medical grade, yes, you don't find them in department stores. If you go to department stores, you might find a cream, let's say, that costs, I don't know, a few hundred pounds, that says lift and anti-wrinkle. But in general, it cannot have the enough active ingredients in it to really make that difference.
Yeah, it just looks amazing and smells lovely.
Yes,
Yeah.
and it's a very expensive moisturizer.
Yeah, I get that.
Most of the time.
Yeah. Here's a silly question. I'm slightly embarrassed to ask. What do you think of homemade remedies like coconut oil and castor oil for clear skin and these things?
Well, if you have acne-prone skin, it's going to make your acne much worse. Other than that, if you don't have acne or you don't have acne-prone skin, the only thing they would do is hydrate your skin or make it look shiny temporarily. But they do nothing with regards to exfoliation, collagen boosting, anti-wrinkle, scar treatment. They have zero effect. But the fact that they're oils, they hydrate the skin. So it's just more hydrated. They're like moisturizers, but that's it. But if you have acne and if you have acne-prone skin, you're going to get side effects.
Okay. How about those people like me who have extremely oily tea? It's a no-no to put extra oil on top of that, right?
Yeah, no, you would go, if you're looking for a sunscreen or a moisturizer, of course, go to a pharmacy to start with, look for a good brand, and then look for something that says for mixed skin or combination skin or oily skin.
Is there something bad in terms of daily practices or routines that we all do and we shouldn't?
And as far as skincare, you mean?
Yes.
Yes. Never ever sleep with your makeup on. That is something some people do and they don't realize its impact on their skin. And never squeeze your spot when you get it. Many people are tempted to just squeeze that spot because you take out the pus and then, it's gone, because it doesn't go, and you just flare it up and it might scar.
What about the junk food of skincare? Something that I should really, really never buy. I'm thinking in my head that I use a tanning. I mean, I'm tanned enough. I don't even. I put on my legs tanning cream. Obviously, it's not good, right?
Not at all. It's very bad. Tanning oils, they're very bad. But I still get teenagers who say, oh, but I'm going to the beach. Can I use my tanning oil? And it's very hard for me to sometimes, most of the time they listen to me. I mean, I can relate to them, but if it's very hard for me to convince them, I would say put your sunscreen on all over your legs, SPF 50, and then if you want, put your oil on top of it, if I can't convince them. But yes, absolutely, that is something really bad. I think also these ready-made face masks, you buy them, you put them on your skin, and they're supposed to do things. They're like these cheap masks, and sometimes you don't know what's in them.
Ready-made. What's ready-made in them? They're
so many different things. Yeah, so many different things. Teenagers love them. They just buy them, and sometimes they're shaped like a strawberry, or they smell like a strawberry, or
that's enticing.
Yeah.
So, do you recommend masks or no masks at all?
I wouldn't. If these. They're like we're talking about junk food masks. No, I would not.
Okay. Skincare is full of misconceptions. What are the biggest ones?
That skincare can, be magical. It can lift the skin. It can prevent sagging, and no matter how good and how medical grade and prescription skincare is, there are some forms of aging it cannot treat or prevent, like the expression lines we talked about, the volume loss, the sagging, the gravity, cannot do it. So even if a cream says lift and tighten,
Surely
no
it
matter
doesn't
how
lift.
good it is.
How
I mean,
would-
it can improve your collagen and tighten in a way, improve fine lines, pigmentation, fine wrinkles, but that's where it stops.
Okay. Now, we can't have an accomplished dermatologist like yourself without talking about brands. We're not sponsored by anyone, and there is no financial transactions between the podcast and the guests. But again, we want a shortcut for our viewers. If you could please advise on one or two brands for their purity, efficiency that you personally recommend, that would be amazing.
Yes, absolutely. So there are a few brands which people can go and buy in the pharmacy without, needing my help. I like there's a brand called Aven. It's
Evan.
Avene.
Okay,
It's
we'll add the links in the description.
It's a French brand. I stock it in the clinic, and I recommend its products to my patients. And it has ranges for rosacea prone skin, acne prone skin, dry skin, eczema prone skin. So then you can choose your moisturizer, your sunscreen, your face wash based on your skin condition or skin type. There are others that are good, like La Roche-Posay or SkinCeuticals. SkinCeuticals has things like vitamin C and AHAs, which you can choose from. And then there are others that are more prescription. Bioderma is a good brand as well. Bioderma is a good skincare range. Again, you can choose sensitive skin, red skin, acne skin, oily skin, eczema. Then you get all your things. And there are the others that are more medical grade. These are medical grade, but I mean there are things that are prescription. For instance, I prescribe Obagi creams, and these are some of them are prescription. They're very good creams, but there's a range that can be bought also without a prescription by pharmacist recommendations, which are called ZO.
Okay. Let's move to treatments at your clinic. I went through your website and I was totally overwhelmed by how many procedures and treatments that you offer. I wasn't even looking for a treatment. I was just trying to educate myself a little bit. How do you decide which treatment goes for which condition or skin issue?
So whether we're talking medical treatment or aesthetic treatment.
Of course, there's a difference. Now, you do cosmetic and you do medical procedures, right?
Yes.
You also do surgical and non-surgical.
Yes.
Okay. And you mentioned something about, you have an examination, you look at someone's face, but how would you decide? Let's start with cosmetic.
Okay.
How would you decide if I have, let's say, wrinkles or pigmentation? How do you decide which treatment is best for which skin?
Yeah. So if we're talking about cosmetic aesthetic treatments, we're talking about beautification now. So this has to come first and foremost from the person himself. We call them patients. They're not patients. They're not sick, but we call everyone patients. We don't call them clients. So I give them a mirror and I start off by saying, what do you want me to address? When you look in the mirror, before I tell you what I would do for your skin, because like you said, I have so many things I can do. You tell me, when you look in the mirror, what is it that is bothering you? Mm-hmm. So they might start by saying, I mostly hate this sagging. I don't like the hollow, dark circles under my eyes. I hate this frown. It makes me look angry. I hate my spots. I don't like my neck. I hate my hands. They make me look aged. So that's where we start off from. Many times they know exactly what's bothering them, and many times they also know what they want to do. But if not, I would start first by addressing what bothers them. So if it's expression lines, I would say, of course, I need to do Botox for you. If you're bothered by your dark circles, this is what I need to do. I need to do these creams. I might need to do fillers. Or maybe, this is a surgical case. I need to refer you to the surgeon. If it's the skin and the pigmentation, I would look at the pigmentation. Is it sun damage only, and can I solve it with some lasers and peels? Is it sunspots, or is it melasma? And then I have to prescribe some creams or do a peel in the clinic, or tablets even. What is it about the jowling? Can I solve it with my lasers and my high intensity focused ultrasound, HIFU treatments with my injectables? Or is it too advanced that, you probably need surgery? Is it your broken lines and facial veins? Then this is the laser. So I have multiple lasers at my practice, multiple different machines that I use, and multiple different injections and procedures that I do.
You just talked about fillers. I've never done anything to my face, but one of my friends did dermal fillers. What are they and how could they help?
Fillers are what their name describes. They fill the gap. So they repair volume loss, or they restore the volume, and they're not supposed to overfill. So when you use fillers and you keep injecting, this is when you get the fake look, the big duck lips, the two huge cheeks. This is overdone. But fillers are supposed to restore your younger look. When we had, the young face has an inverted V look. So it's an inverted V. And as we age, so it's this way.
Okay.
This way. And as we age, things start sagging and we lose, this fat starts migrating downwards. So things start migrating downwards. So, sorry, not inverted V, inverted triangle. So the triangle is inverted as we are young, and then we start losing that.
Yeah,
so
that's why we...
Yes.
Ideally, that would be my younger self.
Yes.
But now, I think it was a year ago when, honestly, I think it was all of a sudden, overnight, I looked at the mirror and I thought, this has dropped a little bit down. This is not how I looked yesterday. That's exactly how it happens. But luckily, there are faces that are structured like that to begin with a lower bone. So I didn't really bother with it. But my younger self was like that.
Yeah, so dermal fillers are composed mostly, the most common ones are hyaluronic acid, which we inject to restore volume and repair volume loss. There are other dermal fillers that are made of different ingredients, the calcium ingredients and other things. But the safest and the ones that are fully absorbable are hyaluronic acid fillers. There are some injectables that don't necessarily just fill the gap, but they push your skin to repair itself and to fill up things like polylactic acid, also known as Sculptra. And then the newer ones would be the polynucleotides, which are injectables, but they're not fillers. They just go and they push your DNA to work better. They push your fibroblasts to smoothen out the skin. So multiple different injections. There are hyaluronic acid injections, and there are others, like for instance, platelet-rich plasma or PRP. People know about this. It's special tubes whereby we extract blood, your own blood, spin it in special machines called centrifuges.
Okay, I want to wrap my head around this.
Yes.
Say that again, please.
So it's called PRP or platelet-rich plasma.
Okay.
This is a treatment that has been used for many, many decades in areas other than aesthetics, like, for instance, in surgery, in bone surgery, orthopedics, sports injuries. Our blood naturally has substances called growth factors. It's present in our serum, in our blood, all of us. Multiple growth factors, epidermal growth factor, vascular endothelial growth factors. These are things that are in our blood. And our blood's, one of the purposes of our blood, or its job, is to rush into any area in our body where there's an injury, to repair it, to repair the injury, to repair the trauma. So there are special tubes, like test tubes, like the ones they use when they extract your blood, but these are special, much more expensive tubes, and they have a gel in them. So we extract your own blood in it.
How much?
5 cc.
Okay.
Just 5 cc. Put it in a special machine called a centrifuge. I have it in my practice. Spins it at a very fast speed, and that separates the blood, which is the red blood cells, white blood cells, from the plasma. And that plasma has the concentrated growth factors. That plasma is then extracted, and so it's your own natural plasma. And it's injected normally, like, let's say, athletes, they have sports injury. They do the PRP and they inject the plasma in their muscles. So that speeds up their recovery so they can go back on the field. Then when they're doing bone surgery, they might inject plasma, PRP, in the area to boost it. Their own, the blood, the person's own. So in aesthetics, I use that in the clinic a lot. So you have the tubes, and I do that. and I extract the plasma, and I use it for two things: hair loss and skin. So when it's injected in areas where there's hair loss, of course, in combination with other treatments for that specific hair loss. But some types of hair loss, like for instance, you lose your hair because you've been on a very strict diet. That boosts the repair process, so your hair grows quicker. After a hair transplant, hair transplant surgeons would refer patients to me to give them PRP to boost that growth of that hair follicle that they implanted. And in cosmetics, we would do injury like microneedling, do a little injury in the skin and apply or put those growth factors, plasma, and that also stimulates the skin.
Yeah, I watched one of your videos. You're talking about microneedling and CO2. One of my friends, the same friend who did dermal fillers, she also did CO2 laser in this section of her face. It was last month, and it was her birthday, so I wanted to give her a little thing. But she said to me, I'm hiding from everyone. So I dropped by and I saw her face. This area looked slightly burnt.
Yes.
But when I saw her later, 2 or 3 days later, she was perfectly fine. And there was a sense of clarity, tight clarity.
Yes.
I'm not sure how to describe it, but it's like a baby skin. And I look, ooh, wow, that's nice. Then I've seen one of the videos, you talked about microneedling, how you inject small needles into the skin. And I'm going to quote you on one of these things. Actually, this is related to the CO2 laser, creates micro wounds which can cause the skin to, and I quote you here, rush to heal itself. And by healing these micro wounds, I will create newer collagen and tighter skin. I found that image absolutely fascinating, and I was wowed by it. So by inflicting like calculated damage to the skin, it triggers its natural ability to fix itself, right?
Yes. Yes, this is the concept behind microneedling, chemical peels, fractional laser, CO2 laser, or the non-ablative fractional laser. So CO2 is an ablative laser. It actually uses light, which is the CO2. Like, lasers, we can do a podcast specifically about lasers. I can talk forever about lasers. But lasers, each laser has its own wavelength, specific wavelength, and each laser is absorbed by a certain ingredient or substance in the skin. CO2 laser is absorbed by water in our skin, and it has a very specific wavelength. And when the CO2 is absorbed, when we hit, of course, it's very calculated. So I would specify the shape, the density, which means the number of dots per pulse, the energy, the power, how deep I want to go. So it's very precise and very calculated. And it's actually I love doing CO2 lasers. It's my one of the most common procedures I do, mostly in the winter time. It does create micro injuries in the skin, very calculated, and with even a certain shape. So if you look at one of the videos, when it goes close up, you can even see the pattern. So I can choose a square, a rectangle, a hexagon, and that's how they hit the skin. So it creates those injuries, and it also, that heat that builds up, shrinks the skin a little bit, or that heat coagulates the skin. We call it coagulation, thermal coagulation. And I use CO2 to treat wrinkles and scars mostly. It does have a downtime more than 2 or 3 days. It's 7 days. You need about 7 days for the scabs to completely fall off and your skin to heal. I prep them before, and I give them very strict post-care instructions. And yes, they need to hide from the sun during that period. Otherwise, they get pigmentation. So they need to be indoors for the CO2 laser. And it, does wonders on wrinkles, clarity, pigmentation, and scars as well.
How does these treatments feel, like microneedling or the laser? Is it painful?
So I hate inflicting pain, and everyone says you have a very gentle hand, even when I'm doing injectables, because I don't like patients to feel pain. So I do numbing creams for almost everything. So with a numbing cream, let's say we're talking about the CO2, I get a strong, really strong, we prepare it in the laboratory, numbing creams. Once it's applied on the skin and left for enough period, your skin is numb. So you do feel a bit of a sting, but it's bearable.
Yeah, that's good. Also, in one of your videos, I've heard you talking about liquid facelift. Until now, I'm resisting the temptation of asking ChatGPT, what's so liquid about it? And is it different than like surgical facelifts?
Yeah, liquid facelift refers to injectables. So you're injecting liquids to tighten and lift and give that face the inverted triangle look again. So liquid facelift refers to a combination of botulinum toxin and dermal fillers injected in a way to restore that balance, like we said, lift and fill. And in contrast to a surgical facelift, the surgeon would cut the sagging skin, remove the excess skin, and stitch it back up in very simple terms. Whereas a liquid facelift, we're injecting liquid, which is Botox and fillers.
Let's say I'm a middle-aged woman, and I don't have any medical conditions, but I just want a boost to make me look fresher. Nothing too invasive or dramatic. What would you advise for me to glow as long as I can?
So if I'm looking at your skin, and if we're talking about you specifically, if you don't have...
not necessarily me, to be
just
honest.
in general.
Yes, in general, because this is what most women look for, just a fresher look.
So a very mild chemical peel might give a little bit of freshness. Microneedling is not that invasive. You just get redness for a day or two. Microneedling in combination with platelet-rich plasma, PRP, can give a fresh, nice glow. Lasers that are not invasive, so not the CO2 laser, because that's, you need a week off. But things like the non-ablative fractional lasers, like the Nd:YAG laser. I have a laser at my clinic called the Clarity laser, which, it's not painful, doesn't need downtime. You can do it in your lunch hour, go back to work, wear makeup after it, just gives a nice glow.
So it's a half a day downtime kind of thing?
Not even less, even nothing. And things like skin boosters, like there are some skin boosters that can be injected, no downtime. It's just a little prick. Sometimes you might have a little spot where the needle enters, things like Profilo or skin boosters. So these are gentle, easy things, no downtime, and they give a glow.
Here's another funny question, and I'm not sure I'm being scientific here. Can I do mix and match with these treatments? Like, can I have a laser treatment and a microneedling procedure, for example, on the same week? Are there any downsides to this approach?
Yes, it depends on which treatments I am recommending to my patients and what treatments they are doing. Some treatments can be done on the same day. Others cannot be done within a week, so it all depends. So your question was, can I do microneedling and laser,
for example,
in the same day? Normally not, if we're doing them on the same area. So if we're doing procedures on the same area and they both like abrasive procedures or lasers and peel and lasers and microneedling, I wouldn't do them on the same day. But for example, you come to me and you say, or I tell you, you would need, let's say, botulinum toxin here, fillers here, lasers here. Yes, I would do them on the same day.
I have a question about skin tones. Thankfully, we're a very multiracial country here in the UK. Does my skin tone, whether it's dark or fair, affect which treatment I might have?
Yes, that mostly relates to lasers, because lasers are light, and some lasers are absorbed by melanin in our skin that gives it its color. So some lasers are not safe to be done on dark skin tones or tanned skin, because then you would have some side effects. But apart from that, apart from lasers or maybe some chemical peels, your skin tone will not necessarily prevent you from doing other procedures, like injectables, microneedling, skin boosters, some types of lasers. So, and also with the right preparation and the right post treatment and following my guidelines specifically, I have a good experience even in treating darker skin tones with lasers, especially because also before I practiced in the Middle East, and here I do get people from all skin tones, ethnicities. So I have a very good experience in treating dark skin tones.
I have one of those IPL hair removal devices at home. I got it from one of the pharmacies on the high street. They are very, very efficient. I've never questioned whether they are safe or not. Are they?
They are less powerful, much less powerful than the machines, even the IPL that we have in the clinic, that's doctor-led, or, these big machines. So these, the ones we have in our practices and we use, are much more powerful than the home health devices. In that sense, they are safer. They are safe, quote unquote. But of course, you need to follow manufacturers' instructions. If your skin is tan, don't do it, because you can still burn yourself. If you have a rash on your skin, if you have spots, don't go ahead and laser, because then if you have a skin infection. So you need to still follow the guidelines.
Away from these lovely feminine things, do you sometimes see men at your clinic looking to look nicer?
Yes, I do get men. I get more women, of course, but I do get men. The common things they would do would be Botox, because they don't like the frown, especially if they are like in an executive position, and they are in a position of authority. They have people working for them. They don't like to look angry all the time. They do things like under eye fillers or dark circle treatment, because it makes them look tired and they don't like that. They might do things for spots, for brown spots. They might not like moles that I would remove. So they do things, but of course, less than women.
Please share with us the one thing that I can do at home daily to support my skin health without the need for any procedures.
Use your sunscreen.
Use your sunscreen, yeah.
Every day.